in mind that at this point in time, there are antibody tests going on that are not FDA approved in sites all over the country. And the false results of those tests range from, 5% to 35%. There are some that have been approved by the FDA, but even the FDA has issued what I would describe as qualified commentary on them and said that several of them have not gone through what they would refer to as the traditional review and approval process that would normally take place. I think it's critically important for the FDA, and this is something I have talked about, we have talked about collectively, not just here in Massachusetts, but governors generally around the country, that the FDA, especially when it comes to testing, has a bigger and broader role than the one that it's been delivering on so far. And many of us urged Congress to make sure they provided additional funds and support to both the FDA and the CDC in this last round of federal response to the COVID-19 crisis, and they did. But to really ramp up in a big way antibody testing that can be deemed as reliable, okay, the FDA needs to decide, needs to do the work and then decide which tests they view as being the ones that are approved and effective and accurate. And at that point in time, a lot of people, including us, will do a lot more of it. But the research work, for example, that's being done by MGH with the City of Boston is a very particular kind of test that MGH has a lot of faith in, and I think is going to yield some useful information. But broad antibody testing needs the federal government, and especially the FDA, to step up and give states and providers a lot more guidance than we have now, so that we can get to a point where we're using a test that doesn't have false readings that can run as high as a third of all the tests that are delivered.